Hey, Dr. Dennis, I'm looking to improve my smile and I have a few questions. What is a dental veneer?
A dental veneer is a tooth covering that can correct a shade that you don't like, the color of your teeth, cracks, breaks, the shape of your teeth, teeth that are out of place. It basically gives you a Hollywood smile. Now, if you can imagine, and I love to give this analogy to my female patients, if you can imagine if you were having your nails done, they would put a covering on the front side of your nail only. So what a dental veneer does, it's the shape of a tooth glued onto the front of your tooth. The back side of your tooth is still your natural tooth, and it still requires just a little bit of to take away in order to add that to the front. And we can choose any color we want, looks great.
What is the process like?
The dental veneer process is very similar to having a crown done. If you've never had a crown done, this is how it works. On the first visit, we make any modifications to your tooth that are necessary. We take a mold of the teeth. We put a temporary veneer onto your teeth, which actually usually looks quite similar to the shape of what your final veneer will look like. Sometimes we can even take a step further and give you a preview before we've actually done the veneer that the lab can create, so we can kind of work out any shapes and discrepancies like that. Once we've taken that mold, we send it to the laboratory. It usually takes about 2 weeks or less, and then the laboratory will send us back the veneers. You will come in, we take off the temporary veneers, and then we cement the permanent veneers that are made of porcelain onto your teeth. Like I said, that takes about 2 weeks. Sometimes we can rush that process depending on what's going on in your life, but it's a very simple, straightforward process. That second appointment, by the way, there's no anesthetic involved. It's a very easy visit.
What are my whitening options?
Whitening is one of the most requested things that we have in our office. Everybody wants whiter teeth. It's interesting because even when I think somebody's teeth are already quite white, they still want whiter teeth. I think it just makes you look younger and you look better with whitened teeth, even if your teeth are crooked. So let's talk about the kinds of whitening that we have in the grocery store or Target or Walmart or that sort of place. There's whitening toothpaste, there's whitening mouthwashes, there are whitening strips like Crest white strips, those sorts of things. Everyone asks me if they work. The answer is yes and no. Everyone's teeth are different. I've had patients try out some of these products and get great results and not such great results. The main difference between a whitening product that you get in a store versus a whitening product you get in a dental office is strength. Most whitening products are made of carbamide peroxide, which is some sort of hydrogen peroxide, and they work. It's good for daily use, but you're not going to get dramatic results. But if you get a whitening product in the office, then the strength is going to be much higher in terms of percentage. Now, let's talk about some of the whitenings there are out there, like Zoom. I mean, there are many, many whitening brands. I probably, at some point or another, use them all in our office. What I like to do in the office is I like to do whitening at home with trays. We make a tray specifically for your mouth. You use whitening gel in the tray, and you use that either overnight or a few hours a day. And you do that for about 10 days to 2 weeks. After that, very soon after that, you'll come into the office and you'll sit under the blue laser whitening. Some people like to call it Zoom whitening, depending on the brand that we're using. And you'll sit there for about an hour under the light. Now, some people like to do the whitening under the light by itself, and it will work great for them. Some people like to do the whitening at home, and that works great for them too. But the reality is that when you do the double of the whitening at home in addition to the whitening in the office, that's when you're really trying to get your maximum result. And like I said, that's different for everyone. Some people will whiten 10 shades and some people will whiten 2 shades. So it's different from your starting point. Again, like I said at the beginning, if you can imagine your teeth are already very white, you're only going to get your teeth so much more white. If your teeth are very dark, you have a lot more steps to go up on. So that's whitening in a nutshell. There's many more things that I could say about whitening, but the reality is you have to try for yourself and see what results that you do. And even when you whiten, you have to have some sort of maintenance. If you're not maintaining your whitening, all the coffees you drink and the teas you drink especially, red wine, tomato sauce, pretty much everything stains your teeth, will continue to stain them. So there has to be a balance between the whitening that you're doing and then also the foods that you're eating, because you still want to enjoy your life. So whitening is just going to make things better.
I'm curious, what do the stars and celebrities have? How do I get that Hollywood smile?
This is one of my favorite questions that patients ask me. They always name a celebrity. They'll name somebody like Kim Kardashian or Miley Cyrus or Nene Leakes, and they'll say, well, what do they have? And the reality is the majority of stars have veneers. I know everyone thinks they just whiten their teeth and they just came out perfect out of the womb, but most of them have dentists. They see their dentist. They take care of their teeth. I always used to note about Whitney Houston, for example, that when she sang with a really wide mouth. Can you imagine if her teeth were not good looking, how important that would be? They're on camera all the time. They need perfection. They need teeth that look great. So most of them have either been through braces, some sort of braces, that they've had veneers, they've had crowns. Another realm of celebrities and stars that have a lot of veneers and crowns like that are football players. I often watch Sports Center with my husband, and I'll say that guy has crowns, that guy has veneers, and you can notice how their smiles change over time. I mean, even boxers like Floyd Mayweather, he has a beautiful smile, and believe me, he protects it with his mouth guard. People like LeBron James, they have mouth guards and they take care of their teeth. One of the other things that I always think is interesting is when I'm watching a reality TV show, for example, and you'll see in season 1, their teeth are all messed up and everything like that. And I think they watch the season and they go back and they say, oh wow, that's what I looked like last season. And they come back, no gaps, no spaces. Teeth are perfect. Why? They went and got veneers. They don't have time to go through braces for 2 years. They don't have time to do all those things. They get veneers and bam, Hollywood smile right there. So most of those stars, they're looking for the quick fix, and the quick fix are veneers, because veneers can fix everything. They fix if your teeth are crooked. They fix bad stains on your teeth if your teeth are not white enough, and they keep them permanently white, by the way. Veneers do not change color. They're not going to get darker over time, even with coffee drinking and that sort of thing. So you have the stability of the color, shape, all of that, gaps, spaces. I can just keep going on and on about different celebrities and how I've noticed their smiles change over the years. Even somebody like Tom Cruise, you know, he has a lot of dental work done. So it's one of those things when you're in the public eye, and you have to think of yourself in a different way, because you are in the public eye too. If you're a waitress, if you go to church, if you are in any sort of customer service, you're going to be talking to people and they're going to notice your smile. So maybe you're not on TV, but your smile is important. It makes you feel confident. I know so many people hide their smile when they laugh, and it affects the way that they feel about interacting with people. So if that's something that you want, not just because you want to look like Hollywood, but you want your teeth to look great and feel good about it, maybe you should consider veneers. Maybe you consider some sort of cosmetic dentistry. Maybe you should consider braces or implants. There are so many things that we can do to kind of get you to your maximum beautiful smile. That's what cosmetic dentistry is. Cosmetic dentistry is healthy. Cosmetic dentistry looks good. That's what it is.
What if I have missing teeth in my smile line?
I'm missing some teeth in my smile line. What should I do?
If you're missing teeth in your smile line, it's one of those things that there is no reason that you should not have that fixed. One of the teeth that I think are one of the most often missing teeth that can restore your smile is a premolar. Now, in terms of dentistry, if you think about it, you have your front teeth. Then you have these medium-sized teeth that are right about here. Those are called your premolars, and then you have the molars. The molars are behind those teeth. Now, premolars, when you smile, and depending on the size of your smile, I have people smile and you can see all the way to the back, and I have people that have mustaches or different things and it kind of hides their smile. But mainly for women, if you have a tooth missing in this area, that's really in your smile line and you should have it fixed. Most of the time, and I say most of the time because there's different scenarios where that is necessary, a dental implant can fix that. You can't believe how many times, and I actually recently saw someone who had a tooth missing right there, had it missing for many years, and it just changed the way she spoke and smiled by having that one tooth missing. If you have that interrupted space right about there, doesn't look good. So I have lots of people, they have from canine to canine, they have their front teeth, but that premolar is missing. You want to get those teeth filled, and most of the time that's going to be a dental implant to restore your smile to a complete smile, no interruptions.